Imagine waking up one morning and the world looks different. Not a little different. Half of it is gone. One eye sees clearly. The other sees shadows, shapes, and blur. That's not a hypothetical. That's my life.
My name doesn't matter. What matters is what happened to me, and what could happen to anyone. I have a disease most people have never heard of. It gave me 3 strokes before I turned 50. It destroyed the vision in one of my eyes.
And it's never going away. This is the story of what Behçet's disease took from me, and why I'm still here to tell it.
Behçet's disease, sometimes called Behçet syndrome, is a rare autoimmune condition that causes chronic inflammation of the blood vessels throughout the entire body. Doctors call it a systemic vasculitis. It can attack any blood vessel, any size, anywhere.
Arteries, veins, capillaries, from your brain to your eyes to your gut. The disease was first described in the 1930s by a Turkish dermatologist named Hulusi Behçet, who noticed a pattern of mouth sores, genital ulcers, and eye inflammation in his patients. Nearly 100 years later, there is still no cure. Most people in the United States have never heard of it. But along what historians call the Old Silk Road, from Japan through the Middle East to the Mediterranean, Behçet's is one of the leading causes of blindness. Behçet's doesn't announce itself with one dramatic moment. It creeps in. For many people, the first signs are painful mouth sores, deep ulcers that look like canker sores but come back over and over again. Then genital sores appear. Then skin lesions, joint pain, fatigue that never fully lifts. Most doctors don't recognize it right away because the symptoms mimic so many other conditions. The average time to diagnosis can take years, and during those years, the disease is silently attacking your blood vessels, your eyes, and sometimes your brain. By the time you get the right diagnosis, the damage may already be done. The strokes came without warning. A stroke happens when blood flow to part of the brain is blocked, or a blood vessel in the brain ruptures. Behçet's disease causes inflammation inside blood vessels, which can create clots, narrow the vessels, or weaken their walls. The brain doesn't care why the blood stopped flowing. It only knows that cells are dying. My first stroke changed everything. One moment I was fine. The next moment, the world tilted sideways, and my body stopped listening to my brain. The second stroke confirmed this wasn't a one-time event. And the third stroke, the third one, made it clear that my life was permanently divided into before and after. Each stroke takes something. Sometimes it's obvious. Weakness on one side of the body, trouble speaking, confusion that lasts for days. Sometimes it's subtle. A word you can't find, a thought that slips away before you can grab it. A reaction time that's just a half second slower than it used to be. Recovery from one stroke is hard enough. Recovery from 3 is a process that never really ends. Your brain can rewire some pathways. Doctors call it neuroplasticity. But it's slow, exhausting work. And you do it knowing that the disease that caused the strokes is still inside you, still inflaming your blood vessels, still capable of doing it again. Then came the eye. Behçet's disease is notorious for attacking the eyes. It causes a type of inflammation called uveitis, swelling inside the eye that can damage the retina, the optic nerve, and the lens. Up to 25% of Behçet's patients end up with severe vision loss. In my case, the inflammation triggered a cataract, a clouding of the lens that blocks light from reaching the back of the eye. Surgery repaired the cataract, but the damage from the inflammation had already taken its toll. Even after the repair, I lost roughly 45% of the vision in that eye. The doctors saved what they could, but what was lost is not coming back. When people ask what it's like to be partially blind in one eye, the honest answer is exhausting. Your brain constantly works overtime trying to compensate. Living with Behçet's means living on medication, immunosuppressants to keep the disease from flaring, anti-inflammatories for the joint pain, medications to manage blood clot risk after the strokes, eye drops, pain management. The pill organizer on my nightstand isn't a convenience, it's a survival tool. Miss a dose and the inflammation can roar back. Take too much and the side effects stack up. Nausea, fatigue, increased infection risk,
Because the drugs that control Behçet's work by suppressing the immune system, you're essentially choosing between letting the disease attack your body unchecked or weakening your body's defenses against everything else.
There's no good option. There's only the less bad one. The part nobody talks about is the isolation. When you have a disease most people can't see, they assume you're fine. You don't look sick, at least not in the way people expect sick to look. But invisible doesn't mean painless. The fatigue from Behçet's isn't regular tiredness.
It's a bone-deep exhaustion that sleep doesn't fix. The brain fog from the strokes means some days you sit down to do something simple, and 20 minutes later you're still staring at the screen trying to remember what you were doing. Friends stop calling because you cancel plans too often.
Family members get frustrated because they don't understand why you can't just push through it. And explaining a disease nobody has heard of gets exhausting on its own. 3 strokes and partial blindness qualified me for Social Security disability insurance. And while I'm grateful that safety net exists, living on SSDI comes with its own set of challenges. The average monthly benefit barely covers the basics. The rules around earning extra income are a minefield. Earn too much and you risk losing everything.
And the system treats you like a suspect. Continuing disability reviews, paperwork, documentation, proving over and over again that yes, you are still disabled, and no, the disease that attacked your brain and blinded one eye has not magically disappeared. The bureaucracy of being disabled is a full-time job, and it pays nothing.
Every few months, I sit in a chair just like this one, and a specialist shines a light into my eyes to check for new inflammation. Every visit is a question with no guaranteed answer. Has the Behçet's stayed quiet, or is it gearing up for another attack? Because that's the nature of this disease.
It's chronic, it's relapsing, and it follows no schedule. Some patients go years between flares. Others get hit every few months. The uncertainty is its own form of suffering. You can't plan your life around a disease that refuses to be predictable. All you can do is take the medication, show up for the appointments, and hope that this time the inflammation stays asleep a little longer.
So why am I telling you this? Because somewhere right now, someone just got diagnosed with Behçet's disease, and they're terrified. Someone just had their second stroke, and they're wondering if life is over. Someone is sitting in a doctor's office being told they've lost vision in one eye, and they don't know how to process it.
I'm telling this story because when it happened to me, I couldn't find anyone talking about it. Behçet's has no celebrity spokesperson. There's no colored ribbon most people recognize. It's a rare disease in a world that only pays attention to common ones. If hearing my story makes one person feel less alone, or convinces one person to push their doctor for a real diagnosis instead of accepting another round of "we're not sure what's wrong," then this video did its job.
Behçet's disease took a lot from me. 3 strokes, nearly half my vision in one eye. The career I used to have, the energy I used to take for granted, the ability to plan more than a few weeks ahead without wondering what my body will do next. But it didn't take everything.
I'm still here. I'm still thinking. I'm still creating. And I'm building this channel, Rolling Disaster, because the disaster didn't finish me. It just changed the road. If you're living with Behçet's, with stroke recovery, with vision loss, with any invisible illness that the world doesn't understand, you are not alone.
Subscribe to Rolling Disaster. This is just the beginning, and we've got a lot more to talk about.